Hey, good evening, everybody. Yeah, today is very happy that we have this session of live, and today's topic will be very interesting. And we also have our special Dr. June with us here for live. And let's start. Okay. So before we start, let me introduce. I think I have not been doing live for some time. So I'm Dr. Jeff from Revis Clinic, and I also would like to announce that we have changed Revis Clinic since from Revival Clinic since early of this year, 2025, and now we are back here again with everyone to share our knowledge and to create more awareness for everyone. And our topic today is about melasma. Right? Let's introduce Dr. June.
Hi everyone, nice to see you all in this afternoon. My name is June. Yes, I am new to Rick's Clinic, and today me and Dr. Jeff would like to share about melasma. This all because we have seen that many people who are having melasma have tried a lot of treatment or method before this to get rid of the melasma, but even after trying some facial product or even laser, maybe most of them doesn't really get rid of it, but even get worse. So in today's session, we will dive you through what really is melasma and what is there beyond the skin problem and how we can really get rid of melasma.
So we can see Dr. June, even though it's new to Revix, but she has already have a very in-depth experience in treating and knowing about melasma. And of course, today's two of us here will be sharing our thoughts and also breakthrough technologies and ideas in treating melasma. Right? So I think many of us know what is melasma or heard about melasma, but we also anyhow would like to explain again what exactly is melasma. Right? So okay, maybe start from me. Okay. Melasma is a skin pigmentation on the face problem and commonly affecting a lot of people, especially female more than male, and it affects the patients of the person's face, okay, mainly at the middle of the face. And the characters of pigmentation is usually as two patches of pigment with very ill-defined border, and the color tone could be dark or a mixture. And commonly affected population is usually mid-age, middle age, 30, 40 years and above. And there are many reasons behind, and that's why today we are doing this live to explain in depth to every one of you about what is exactly the cause of melasma. Right? How about Dr. June? In your experience of treating melasma, what is your thought of melasma?
Melasma. Yeah, melasma is basically there's an overproduction of the pigment cell.
Overproduction of pigment, yes.
Overproduction of the pigment cell on our face, on the skin. Okay. And then other than pigmentation, there's also like collagen degradation.
Collagen degradation, okay.
Yeah. Alright. Because of aging or maybe sun exposure, then our skin quality is not that good. And then it's prone to have those inflammation.
Inflammation, okay.
Yes.
So, okay, Dr. June have to be louder, right?
Okay.
For audience want to hear you better. Okay, so meaning to say melasma is a complicated skin pigmentation. Not only pigment, but also involving several other factors, right? So from Dr. June's point of view, and also same to me, melasma is a tricky pigmentation problem. It's not straightforward. So it's not saying that, oh, you have a pigment, then you do something to lighten the pigment, and the pigment will gone forever. No, it is not. It is something worse or even beyond that. It involves not only pigmentation issue, but also collagen issue and also inflammation issue. So let's look into what exactly the melasma is. But first of all, we share some information or some pictures, okay, to illustrate melasma so that more people can really get the idea better with what is melasma. So on the screen, we can see there are pictures showing patient with melasma. So you can see the patches of pigmentation usually involving the front part of the cheeks, and the color is a bit light browns. So sometimes they call it a 黄褐斑 or yellowish brownish kind of pigmentation. And commonly we see is involving the cheek, front cheek. Some may extend up to the corner of the eye, the side here, and also up to the corner of the mouth on the upper part of the lips. And it can also involve up to the foreheads, right? And also our mustache area, some even the chin area, right? Some people even involve up to the side, on the Simon area. Yeah, so it could extend, but the most commonly affected is middle of the cheek.
Yes.
And also, this is from my experience, not only thin or fair skin people will have pigmentation. Even people who have oily type of skin, coarse skin, or dry skin, or even aging skin with losing of collagen, very dry, very flabby kind of skin, also may have
Yes.
pigmentation or melasma. So, melasma do not really care whether you have what kind of skin, you will attack or you will come. Yeah. So the problem is not because you have certain kind of skin, it's rather more on another factor which we will be sharing today. Yeah. But this is a character of pigmentation. How we diagnose or how do we say that a patient has melasma? Or maybe let Dr. Jun share with us how we actually diagnose. Right? Diagnose means we definite saying that your pigmentation is melasma.
So basically first we have like during inspection over the patient face, and then like what Dr. said, Jeff said just now, it's usually bilateral. Yeah.
On the side, on both sides. On the side.
Yeah.
Okay.
And then the appearance of the pigmentation will be like blotchy. Means it's not just like one dot. Maybe it's like
patch.
Yeah, patches.
Okay.
Some
patches,
is very visible. Some may be like a bit lighter. This is because the pigmentation in melasma is in different layer of our skin. Some is more outer layer. Some is more inner layer.
I see. Okay.
Yeah. Then other than like the eyeballing inspection, then we will take picture of the patient's skin and then to see through the 3D analyzer. Yeah.
Okay, this one I agree. Because melasma usually we diagnose by looking, inspection, or we just by looking, visualization, and the color because the character of pigmentation is deep and surface, so we have multiple different layers, so the color will be uneven, but very light, and with patches. But of course, sometimes when we diagnose a patient with melasma, it cannot be so convincing. We need to have a picture, a technology of photography to capture the skin texture and the pigmentation better, so we can visualize it better, and this helps us to get to know the pigmentation severity better. So from there, it helps us to diagnose and also help us to guide in our treatment plan, right? Okay. So I think this is roughly what we can know about melasma, and from the pictures we saw lovely, you can get the picture. Sometimes, even though you are not a doctor, you just visualize and see. You also can see, hey, this is melasma, right? So because it's a very common pigmentation issue, especially in Asia, a lot of Asian people who have this kind of brownish skin tone, not very fair, not very dark, and when they exposed to sun, which is our country, which is hot, we are exposing ourselves to sun most of the time, so aggravates the pigmentation. Okay, listen properly, it's aggravating. Sun is not a cause, but it's an aggravation factor. So okay, anyhow, I think it's a common melasma. Melasma is a common issue for everyone. So let us discuss what is actually we know about melasma and what we are not really knowing right, okay, on melasma. So a lot of people knows melasma caused by sun. What do you think, Dr. Jun? Is it cause of the melasma is sun exposure? Means I expose to more sun then I get melasma. If you don't want to get melasma, you don't get under the sun. Is it right or something else?
I would say sun exposure is not the definite cause. Because some people may expose more to the sun, but some people just stay at home also. They may get melasma also, but for those people who under the sun may get triggers more.
So sun is just aggravating or triggering the melasma to be worse. It doesn't cause the melasma to occur at the first place. Meaning to say, if your skin do not have a melasma issue, you won't get melasma by exposing yourself to sun, right? Even though you expose excessively, you will only get sunburn, but you won't get melasma. But if your skin already forming melasma, by exposing yourself to sun exposure, that will aggravate the pigmentation formation faster, and your melasma will be visualized easier and faster, right? So this is a proper facts about melasma. Don't get it wrong. Why? Because if you understand and you think that sun exposure is the cause of melasma, what will you do? You will be treating your melasma by doing sun protection. So then you think that it will cure your melasma. In fact, it's not, right? So by doing sun protection is helping your melasma to lighten easier and faster, but it's not curing. Right? So now come to the word curing melasma. In a dermatological point of view, is it curable?
Melasma.
Is it? Yes, is melasma curable?
Yes, it's possible.
Are you sure? People say cannot cure. Okay. So you see, Dr. June and I here, we're sharing here. Actually, we know and we understand. We like to share about the root cause of melasma. If we understand about root cause, then we are looking into a more promising, curable way of treatment in melasma rather than controlling. Right? Most of the time, when we have melasma issue, what we are treating the triggering factors. Triggering factors are that causing the melasma to be worsened. So if you treat the triggering factor, you are only lightening the melasma, but you are not stabilizing and curing or getting rid of the melasma completely, right? So on the screen, we can see there are multiple triggering factors. Beside the sun exposure, there are also some other factors. For example, hormone. Yes, if you have hormonal issue, imbalance in your body, you will have melasma aggravation. Okay, what else?
Like maybe when you're in stress, emotionally stable.
Yes.
Maybe you have bad sleep quality.
Yes.
Then maybe when you have like poor quality, you have some liver toxic, maybe from the lifestyle that you have, the diet that you're having.
People believe when we drink a lot of alcohol, it may also cause melasma, right? Actually, the alcohol aggravating or accentuate the toxicity in the liver, and with accumulation of toxic in the liver, it will cause more inflammation and it will aggravate your melasma to be worsened, right? So if you have poor sleep quality, if you are under a stress condition, lifestyle all the time, this will also aggravate your melasma faster and easier. Okay, but among these triggering factors, actually it hides a little bit of a point of facts, which is also the underlying cause actually. Because we know melasma, most of the people will think melasma is treatable, yes, but it's not curable. The reason is because melasma is due to hormone. Right? When we think and we understand that melasma is due to hormone, then the answer will always come back as not curable because we are unable to get rid of the hormones. We as a human will live with hormones. We need hormones, right? So we cannot get rid of hormones. If we understand that melasma caused by hormones means you cannot cure the melasma because you cannot get rid of the hormones, right? So the proper understanding of hormone causing the melasma is actually not because of hormone. Okay, hormone is just a role player that stimulating your pigmentation, but what underlying the problem is when your body has over-sensitizing or overactive hormones that working on your pigment cells. That is the scenario that causing your melasma.
Yes.
So meaning to say, if she is a lady, I'm also a lady, both of us, let's say, have estrogen that causing the pigmentation aggravation. So, but let's say she don't have a melasma, I have a melasma. The difference between two of us is probably we have similar level of estrogen, but okay, she probably not so sensitive to estrogen, but I'm sensitive to estrogen. That's why my sensitivity of estrogen aggravates up my pigmentation formation. That causes the melasma cause, right? So I think this is the initial introduction. Okay, I think a lot of people still do not really understand. Okay, but this is an initial understanding or explanation for every one of us here to get to know melasma in a different angle, rather than just keeping our mind thinking that melasma caused by sun, which is wrong. It's aggravating by sun. And melasma caused by hormone, then you are desperate saying that it's not curable because it's due to hormone. Of course, you can't get rid of hormone, which is again wrong. So we know there are aggravating factors. What we are trying to point out is if you don't get the aggravating factor treatment right, you also won't see improvement in your pigmentation. But if you get your aggravating factor treatment right, you are not treating your melasma root cause, you also will not cure your melasma, right?
Yes.
So, okay, let Dr. June explain and sort of share with us. Sometimes when we treat pigmentation, right, why certain pigmentation get worse, or sometimes we don't recommend, like very famously doing laser. Why sometimes we don't recommend laser? Yeah, maybe you can share with us why.
Yeah. So in my practice, I wouldn't have recommend laser as my first line treatment for melasma.
For everyone or some people only?
Some
Some people.
Yeah, I will assess the condition first.
Okay.
Like what we say just now, like melasma, the pigmentation, there is also inflammation in the skin. So the skin actually is on a very hyperactive state. So if we do when we do laser, just do laser, it may how do you say over stimulate the inflammation, and that's why the melasma, the pigmentation will get worse after the laser treatment. So instead of just like do laser straight at first time, so I think we should calm the skin down first, so treat the cause behind it.
Okay. I think a lot of people have been experiencing laser treatment for melasma, maybe even 10 years back up to now. So a lot of people may experience that laser treatment on melasma. Yes, some people may get lightening of pigmentation, but majority of people may not really get rid of pigment completely, and some even get worsened pigmentation out of it. The reason is because melasma issue is not only pigment, it has some skin issue as well. The skin itself is already weakened in terms of losing out the collagen, and it is in the inflammative stage. This is what Dr. Jun trying to tell us. So when our pigmentation issue in melasma, having this kind of skin quality which is weakened collagen and inflammation, when you do lasers, when the timing is not right, the laser's heat can aggravate and burden the skin. It can aggravate the inflammation and burden the breakdown of a collagen loosening. So that causes a pigmentation to be worsened. Yeah, that's why in treating melasma, the tricky part is not saying the pico or the laser is not effective, but it is just a tool for us to lighten the pigment, but it's not the tool to handle the whole thing. Yeah, the whole thing, characters of melasma involve pigmentation, involve the skin collagen, and thinning of skin collagen, and also inflammation. But again, bear in mind, this is what happening on the skin. The cause of this happening on the skin is not due to, this itself is due to some hormone sensitivity in the body. See how complex the melasma is, but actually make it simple to say is, you need to take care of your skin and take care of your inner health simultaneously. Because melasma is an issue of not only the problem on your skin alone, there's something not right going on with the hormones in the body that causing the melasma, right? So in the pictures that we are illustrating on the screen now, we can see some illustration of laser shining on the skin. If your laser is done on the melasma skin, which is already weakened in collagen, the collagen structure is weak, and the skin is also inflammation, that when the laser is done too strong for multiple sessions, then it may aggravate the inflammation and making the skin even worse, and you will worsen the melasma. That's why we don't recommend all people to do pico laser at the first session of treatment. But it's not saying you are not allowed to do laser. Okay, some maybe we also do laser at the first time or first session when we see them. But some we don't recommend because we are considering the inflammation and the collagen, right? So sometimes all this as a sort of reason why we do see some patient when they come to us saying that after they did 1 or even 3 sessions of laser, their pigment get worsened. So they are not confident anymore to continue the treatment. That's why they come to us. So the reason behind here, I would like to share to every one of you, if you are ever experiencing this kind of experience, your pigment get worse after laser, it's not Okay, fair to say it's not the doctors wrong, it's not the lasers wrong, but it's the diagnosis and determination of the skin quality at that point of time is wrong, right? So your skin probably is already inflammative, your skin is already very weak in collagen, but when we do the treatment, you are not considering that factor. So when you do laser, it aggravates your pigmentation, right? Okay. Okay, so since it's so tricky, yeah, complicated, and a lot of people after they successfully, like anyhow they successfully remove the pigmentation, get lightened or happy, but then again after maybe some time, the pigmentation come back. Alamak. Why lah? Why pigmentation keep coming back? Yeah, maybe Dr. Jun share with us why melasma is coming back.
Why? Okay, so yeah, so because there is not only pigmentation, and there's actually we need to look into like something behind in our body that what causing like what Dr. Jeff just now said, like hormone sensitivity, hypersensitivity, because maybe a lot of people mind that for those hormone sensitivity thing is because of like high hormone level.
I think so. Yeah, a lot of people think so. Yeah, maybe I got melasma means I got high estrogen.
But in fact, this maybe not because of the level itself, but actually it could be the total level of the hormone is actually normal, but then is what the free level is means because there is something in our body, our hormone, our sex hormone is actually is binding with something, is in couple with a protein, which we call
So I think we're already putting up the answer on the screen, which is called SHBG, which stands for sex hormone binding globulin. Okay, so Dr. Jun is trying to say, I think I understand what I'm trying to say. So there is a protein that carrying and binding with this sex hormone. This protein called sex hormone binding globulin. And this protein got nothing to do whether you eat a lot of protein or not. It's something that your liver function produce naturally by itself. And the main function of this sex hormone is to bind with your sex hormone, including your estrogen, progesterone, androgen, testosterone, things like that. So it binds with your sex hormone so that your sex hormone function in a sort of controlled manner. But if anyhow your body has less production of SHBG, which is the sex hormone binding globulin, so if you have less of sex hormone binding globulin, the protein bounding to the hormone is lesser. So what will happen? If the level of hormones stay the same, but the binding is lesser, means they are less binding, means not bound hormone, which is called free hormone. When the free hormone is small, then your body will interact with it, sort of it seems like you have more hormones or high hormones, right? I think this explains to why melasma also happen in men. So men, supposedly you understand, men should not have high level of estrogen. Estrogen is the hormone that aggravates things and causing the pigmentation to form in our skin. So if a man, I shouldn't have high estrogen. But why if a man have melasma? I think it explained here because if a man also have low SSBG, which is a binding protein in the body, so that means even though I have less or very low amount of estrogen, but the protein that carrying with bounding with it is less, then the small amount of estrogen become free also. Then with this small amount of free, it become like obvious hormone level in the body that can aggravate pigmentation formation even in a man, right? So the culprit that we now get to know that melasma is cause of low SHBG, and this is the main root cause of melasma. If you get this understanding right, then you will know how to properly cure melasma. If we are not treating how to improve the SHBG, then we are still probably looking at all the aggravating factors, which only lighten the pigment, but it's not properly curing the melasma, right? So I think a lot of people may not know yet these facts, and these facts is actually already been evidently proved in a lot of studies, and this is already been sort of like well-known fact. But to treat our body SSBG properly, right, is also a challenging kind of techniques. So in Davis Clinic, we have been doing it for almost 8 to 10 years by treating melasma in this angle, and we do have a lot of successful cases to share, right? So, but today, our main purpose is to sort of open this secret to everyone or let people understand what exactly happening so that we can reduce our yuan wang lu. Means we can make the treatment right better, right? So do the treatment straight to the point, not hanging around. Yeah, sometimes when you do laser treatment, whatever tools treatment you do, you may see lightening, but you only lighten. You are not properly curing melasma. And one tricky part of skin changes in melasma is when you let the melasma ongoing for long period of time, the character of collagen loosening, the collagen, the inflammation condition is even worse. So meaning to say, 10 years ago, if you have melasma, when you treat the pigmentation with pico laser, you will feel good and improve. But the melasma is not gone, still there. But over the years, when you treat, you will find that your skin quality will become weakened, and you thought that it's caused by a cream that you use or it's caused by the laser that you did, but in fact it's not. Because melasma condition itself can make your skin inflame and damage your collagen and make your skin become thinner and thinner over time. By then, when your skin become thinner and weaken over time, when you do similar treatment again as compared to 10 years ago, like a pico laser, you won't benefit much anymore. Then it may aggravate and cause your pigmentation to become worse. You see, you get the idea right. You get the whole idea. It's because the melasma itself involving not only the skin issue, involving the internal factor. Just now we mentioned aggravating factors of the sun exposure. These are external. The sleeping quality, the stress, the unhealthy kind of fever. But there is only still aggravating factors. The main culprit still due to SHBG. Low in this SHBG stand for sex hormone binding globulin, right? So, okay, let's look at the screen. There is an illustration our Dr. Jun did to illustrate what is actually happening and what is the function of SSBG. I explain, but let Dr. Jun explain again.
Okay, so as what we can see from the slide at the side, the video at the side, you can see that the estrogen is actually bind with the SHBG, but when the bond between the SHBG and the estrogen is break down, then the estrogen will be freely floating in our bloodstream and go and stimulate the
pigment cells. There's one tentacle shape like of cells called pigment cell, melanocytes. Okay.
Yes.
Then
Then from there, because of the pigmentation cell is overstimulate, then and also the inflammation response, then it causes the melasma in our skin.
That's why it causes the pigmentation to become formed and become more. So it's the London Bridge is falling down. The breaching, the bound between the SSBG, sex hormone binding globulin, and also the estrogen is broken down. Okay. So it's a broken relationship of estrogen with the protein binding, that causing the melasma. Okay, now we know, right? So how do we treat melasma properly? Right? Since we know melasma right already, right? So how do we treat? As a doctor, what do we pay attention to when we treat melasma? Right? So can we share a bit?
So when we treat melasma, when we approach to melasma, the timing of doing treatment and the timing of follow-up is very important. We should tackle every part of it, like including the triggering factor, the causes, and of course the low SHBG. That's the most important part of it. So for the triggering factor, if like sun exposure, then everyone knows we should wear broad spectrum sunscreen, SPF 50. And then for hormonal changes, there's not much thing that we can do for it because we couldn't control our menses and also menopause.
Okay, so say that we are not targeting directly how to get rid of the hormone.
Yes.
So the hormone is just a role player,
Yes.
but the problem is the binding protein. So we are not treating the hormone. We are not using hormone. Okay, but yeah, we're supposed to treat the SSBG. Okay, nice.
Then,
So
for emotional part, you can go for like meditation.
meditation, yes.
To calm down your mind.
Yes.
Yeah, so then if sleep quality, say meditation, or maybe you can get some supplement to help with your sleeping, improve your sleep, right? Then, change your diet, change your lifestyle to improve your liver health status. Yeah, but all these things you can try to improve, but cannot really. You just try to control, but not really cure it. Okay, and then
we are curing it, right?
Yeah. We want
so
to
how
cure
we want to
it.
cure?
Yeah, we will tell you.
Ah,
Later. But then So other than for the triggering factor, we get rid of it, and then for the process like the weaken skin quality, the collagen, and also the inflammation, the capillaries, dilatation, and our skin. Then we can use some machine treatment which more mildly informed, like some radio frequency microneedling treatment to help to strengthen our skin barrier, our collagen, and also reduce the capillary dilatation. So and then the most important part, of course, is our SHBG, which should address this issue and to raise the SHBG. To how to raise, increase our SHBG.
Okay, I think for those who have listened our talk since the beginning until now, this is the most crucial part that you really have to understand, right? Even if you are a doctor, doing aesthetic treatment and looking at our video, I hope that you also can learn something, and we try to share what is exactly how to treat melasma. So when we're treating melasma, what Dr. Jun just shared is actually the timing. You must put the timing right. When we're treating the melasma, as what we shared at the very beginning, we may not really looking into like just using laser, because the aim is treating the whole part of the skin. So we have to pay 3 attention. Let's say on the skin itself, the pigmentation, the inflammation, the collagen. So we need to take care of the whole 3 things simultaneously. Sometimes the skin is not allowing us to reduce pigmentation. So we need to take care of the collagen and take care of the inflammation first. So there are treatment like Potenza, they are one of a brand called using microneedling, which is a very safe and very effective treatment that can help the skin to calm down, to reduce inflammation and to build collagen simultaneously. So sometimes patient we have pigmentation with melasma, we treat this microneedling treatment first to build the collagen, to reduce inflammation, to increase the integrity of your blood vessels and your skin quality. That strengthen the skin back. So when the timing is right, again the overall principle is the timing. When the timing is right, then we do lasers to lighten the pigment. Without the good quality of skin, your pigment will not go away, your skin will get worse. So we must get the timing right. So the design of treatment or the strategy of treatment has to put into consideration of all these 3 factors, the pigmentation, the inflammation, and collagen. So all these we have to plan, maybe how many sessions of microneedling have to be done first. We have to monitor the skin response, whether it is already showing the response and improvement. Then the skin is right and the condition is sort of bearable, so then only we do quicker laser to lighten. So this is a strategy on the skin. Beside that, your lifestyle, we have to take care on your skin care, enhancing in your sun protection, enhancing on your sleep quality, your stress handling. All this has to put into consideration, and we as a doctor will prescribe you or sort of recommend you certain kind of supplement if necessary. If you would like to have better sun protection, there are oral sun protection. If you want to have a better sleep, there are supplements that improve like melatonin and magnesium can improve your sleep quality or even improve your stress handling. There are certain nutrition like ashwagandha, selenium, which will improve your energy, reduce your stress, so that you don't feel tired, you will feel more happy from this supplement. So there are supplements that you can be taken together to handle your melasma. So you see, taking care of melasma on the surface itself is already so much to take care about, but you are still not yet reaching the root cause. The root cause is how to improve the SHBG in the body. So the culprit here, okay, let's talk about SHBG. SHBG is when our body has high inflammation, okay, then your body will actually reduce in the production of SHBG. Again, when the body has high inflammation, the inflammation will distort or sort of burden the liver's function, and the liver will become weaker and will be reducing in production of the SHBG. So nowadays, in this functional way of medicine, people are already looking into a mitochondrial health of the cells. Okay, for everyone who are very scientifically sort of jargon here, okay, sorry, okay, I need to explain a little bit. In our cells, there are energy generator called mitochondria, and this mitochondria is very important to generate energy for our cells, including liver cells. So if our body has high inflammation, so this inflammation will burden the cells, and the mitochondria will produce less amount of energy. Then we will become tired. So what happened? Let's say liver, okay, is the most important organs that handling all the toxins and inflammation. So if the body has high inflammation level, the toxic accumulate in the liver. Liver is the first organ that will be burdened. But you won't see any sickness or illnesses. But melasma is an indicator that our body is so smart to tell us that your liver is already overloaded with burden of inflammation and toxics. So the reflection of scientific proof is the liver, when it is handling high inflammation, it will become weaker in your energy generator, which is your mitochondria. And this causes your liver to produce less SHBG. So the answer here is weak mitochondria, low SHBG, right? So weak mitochondria, low SHBG, cause melasma. How to treat melasma? We have to treat mitochondria. How to treat mitochondria? We have to increase energy in the mitochondria, right? So reduce inflammation in the liver is one of the way. Improve mitochondrial health, also one of the way. And if we do targeted treatment like reducing inflammation and also improving mitochondrial health and increase generating of your energy in your liver, that is the treating root cause for your melasma. There are many treatments that we do, but for audience, if you would like to try yourself in treating the root cause, there are certain supplements that you can take to handle this. If your inflammation is not very severe and your mitochondrial weakness is not very significant, supplements like coenzyme Q10, selenium, curcumin, will help you to handle this well. But if you already tried and it is not really helping and significantly showing effectiveness, then probably we need to come into your, step into your, your help, because we need more targeted treatment that can straight to the point, improving the mitochondria in the body. Okay, there are many ways of improving mitochondria in the body, but the most effective way we will be sharing only one today. Okay, the most effective, of course, most will be only one.
Yes.
There are a few effective ones. There are 3 or 4. Okay, most effective, and the breakthrough technology here is using thyroid supplementation, and this thyroid supplementation is only applicable using bioidentical forms of thyroid supplementation and with a technique called optimization. Okay, so this is more scientific for medical use, but for audience, the clue and the tips to treat your melasma, again, we emphasize we have to treat the root cause, and the root cause is by treating your SHBG, improving SHBG by generating or aggravating the mitochondrial health, also improving the mitochondrial health is the fundamental root cause treatment.
Yes.
Okay, on top of treatment that you already been doing, like pigmentation, lightening, pico laser, microneedling, yellow light. Now, there are multiple ways of laser treatment. There are creams available, multiple creams. There are multiple supplements. That only reducing the pigment but not getting rid. But if you're not getting rid, your pigmentation always there, your skin will also become worsened over time. So it's up to you. Yeah. So once you understand melasma, you know what is the right treatment for you. If you think that we can help you, you can call us.
Yes.
Me and Dr. June will be here to help you. Right? So I think this is the information and interesting part that we would like to share with everyone. And okay, maybe Dr. June would like to share some of your thinking or feeling about melasma.
So yeah, so so throughout seeing patients, yeah, and giving treatment, yeah, we can confidently tell. I mean, we can give confidence to our patient that melasma is not something that will be with you forever. You can possibly get rid of it if we are doing the right.
Actually, 10 years ago, we are still thinking about melasma is not curable. Really, 10 years ago, it's not really up to this stage. But now, we are already able to come to this stage, with curing a melasma with this kind of SSBG targeted treatment. So that's why we are happy to share with every one of you. And so some of the case sharing from our experience, which you can see on the screen. So we can see left is the before, right is the after. So we are using a technology of filtration to see the inflammation characters of the skin in the melasma condition. So on the front part, on the top part is actually a normal visualization or normal filtration. On the bottom part is filtration. We visualize the inflammation of the skin. So we can see when the patient gone through the treatment, we are not just lightening the pigment, but we are also reducing the inflammation characters. So which generate stronger stability of your melasma and also improving your skin quality all over. So this is the fundamental sort of result that we want to achieve, not just lightening the pigment. Some 10 years ago, most of the people or some treatment, they are just treating the melasma, lightening the color, regardless whether your skin become thin or sort of become sensitive after that. So we do see many people 10 years ago until now, many melasma treatment end up with a condition, even though the pigment lightened, but the skin is worse than before. It becomes sensitive, become red, become very thin, become very fragile. So these are the sort of, we should not say wrongdoing, but it's like really an old method of treating melasma. Because all this while melasma, before this, 10 years ago, people think melasma is just pigment, nothing else. But along the way, there are many understanding and many evidence been proving that melasma involving the skin quality weakening, the collagen loss, the inflammation. Then more and more technology are coming into it to treat. So the treatment of melasma is better and better now. But now we are treating the root cause. So by combining supplementation and improving your SABG is the fundamental root cause that another breakthrough for us to treat melasma better. So whoever been bothered by melasma for a long period of time, so I hope that you are having this opportunity to see this video from the front until the end, so that you were able to understand what is the right treatment for you. Again, some photos we share on the screen to show some of our cases on treating melasma with this kind of technology. So patient achieving happy result, lightening of pigmentation, improving the skin quality, reducing the inflammation to prevent the relapse. So this is the happy ending for everyone, right? Yeah. Okay. So how do you think, Dr. Jun, in treating melasma, is it tricky and difficult for you?
At first when I'm introducing to this concept, it's a bit challenging. But over time, when you see result in our patient, then I become more confident in treating this melasma issue. Yes.
So actually, melasma, if you say 10 years ago, we don't even realize and understanding these kind of concepts. So there are also not available technologies to treat well on the melasma. So now there are different era, different timing. Somehow after MCO 5 years ago, time flies. So many things change. So more and more sort of available good method of treatment, not including melasma. Fundamental root cause of treatment in other kind of aesthetic needs, like acne, or even like sensitive skin, rosacea, all now handleable well with good technologies. But anyhow, I don't want to get out of the topic. Okay, come back to the melasma. So melasma, yes, from my experience, is a tricky part. Most of female with melasma are looking into quick fix. We understand your pain, we understand how you feel. So whoever who have melasma, of course, we want to have fastest, quickest, and safest, and also most effective treatment to treat melasma. If can, possibly only like one bottle of cream applied, then you will get rid of the melasma overnight and it's bye-bye forever, right? So I understand, yes, I also hope so, but the thing is the reality do not allow. So the reality is there is something to do with the SSBG, which is a protein. Got nothing to do whether you eat protein or not. So it's something to do with inflammation in the body that causing the protein to be weak and lesser in the body. So that cause and sort of translate into your hormones and become hormone sensitive and aggravating of pigment. So this is the fundamental, we will say, the secret unveiled. Sort of, now you know the secret, now you know the reason behind. So treating melasma, yes, we are not saying that you are not allowed or you're not supposed to do pigmentation like laser treatment. You still need to do, because that lightens whatever already formed. But you cannot just solely rely on this treatment to look for cure, right? So pigmentation with pico laser will not cure. It only lighten up to a stage which is maybe good enough for you. But if you let melasma carries on, it will make your skin thin. So without laser, your skin also become thin itself, because of melasma condition itself may cause inflammation of the skin that causes a thinning of the skin. So we don't want to let this thing happen. So how do we really tackle melasma? We have to strategize the treatment, timing the treatment right. What is right to do, what is not right to do. When the timing is right, then what to do. And also treating SSBG is not simple. It's not like 1 day, 2 days. It needs at least 3 to 6 months of period to establish the effectiveness and result. That's why we need to also put in some patience and also some understanding. So, but we can promise that if you do the treatment right from the beginning, then you will definitely get to your results. Okay? But if you're not doing right at the beginning, maybe you are still turning around and around. You may see lightening, but you are not curing. Right? So this is melasma for my sharing. Okay. Any questions? Or maybe we have.
I think there is a question here. What are the key signs that differentiate melasma from other types of pigmentation?
Okay, by eye. We of course looking at eye, the characteristic of melasma usually affecting both sides of the cheeks, very undefined, ill-defined sort of pigment area. Usually it's a patch, and the color could be light, could be dark, because it's a mixture of between old and new sort of pigment. Some pigment become matured, some pigment not matured, newly formed, so it become uneven. So it will extend up to the corner of eye, some even the foreheads, even up to the upper lips, and even up to the side of your jaw area. So these are the characteristics. But of course, now we are also using the technologies of camera photography to analyze better, to see information underneath it. So usually melasma will come along with inflammation. So that gives a further confirmation onto your pigmentation, whether it's melasma or another type of pigmentation. Right?
Can I cure melasma without hormones treatment?
Basically, you can cure melasma without hormone treatment. We are not recommending you to do hormone treatment as well, right? Because melasma pigmentation is aggravated by the estrogen. So the fundamental reason behind the estrogen is lacking of the protein. So your treatment should aim to increase the protein, not targeting on the estrogen, right? So we are not using hormones. See, just now we do recommend certain treatment that can aggravate, sort of improve your SSBG by improving your mitochondrion. So like selenium, CoQ10 enzymes, supplement, and also curcumin. So these are the supplements that you can try. We also prescribe here. For more severe cases, more stubborn cases, or more significant mitochondrial weakness, so then we will use supplementation, bioidentical hormones. This is supplementation of your hormones to optimize your thyroid function, and also then it helps you to improve your mitochondria. So this is a supplementation. It's not medication of hormones using in our treatment here. Okay. So any other question?
Doctor, can you share why so many people, especially women, get melasma?
Basically, melasma affecting almost, if anyone we have low SSBG, almost 20 to 25% of female may have the risk of melasma, because almost 20-25% of female are more prone to get low SSBG. The reason is because it's actually interconnected with a condition called insulin resistance. Yeah. So in the studies and epidemiology statistic to say there are almost 20% means 1 out of 5 female probably have a chance of having insulin resistant, low SSBG, and also risk of melasma. Right? So it just happened like this. A man usually has about 10% in terms compared to 10 to 15% compared to female. So it's much lesser, almost one-fold lesser. Okay. Many questions. Okay, good.
What's the best treatment for melasma that really works, especially for Asians?
Good question. For Asian people, usually we need to combine. There are not one treatment can handle everything. I hope everyone can remember this and always keep this principle right. Don't hope for one treatment to cure everything, especially melasma. It involves multiple angles. So a combination of treatment with proper planning strategy, with good timing, is the best treatment for Asian people with melasma. Right? So I think a lot of people do understand some of the information we already put up in our comments to explain better on low SSBG is the key to cause melasma condition. So I hope that everyone get this information right, and from there on, when you are looking into melasma treatment, this information probably can help you to get you better into treating your melasma right. Okay. So I think time is almost there. Happy again, very happy to have Dr. June and me again in our Revis clinic to share information about our breakthrough treatment in melasma. And we will be organizing live time to time. And our next session is next 2 weeks. Next 2 weeks, 23rd of July. Right? Wow, now July. So our topic will be also another very interesting topic. Yeah. The clue or the hints of the topic is fever good to the body? We know fever. We get high temperature, sick, but it's supposedly is a good condition to the body, right? So if you're interested to know why fever is good to the body, stay tuned with us, in our Revis Clinic Live. And if you do have any issue with melasma or any skin related issue or slimming or wellness issue, you are always welcome to contact us. Now through the screen you can see our contact number, our websites. You can contact us through our WhatsApp, our website, or message, email us also can, or you can directly visit us in our address. Now we are located in Eco Century, and happy to share our information. Thank you everyone. Okay. See you next 2 weeks.